So Medicare for All town hall by Bernie Sanders. They also brought on business people to talk about how this affects their business and the economy. Let's go to Richard Masters, the CEO of one of the companies that they were talking to. Let's watch.
Our company employs 180 people in Pennsylvania and throughout the United States. Our healthcare bill is $2.8 million a year. It cost $27,000 to insure an employee with a family. That's $13.50 an hour, which is, if you put this into context, it is about as much as 1/3 of the population can't make in a year. So this is an outrageous cost. We're beyond the tipping point at this point. We have really got to do something to control costs. Now, we look at the Medicare for All solution. Right now, we are spending about 18% of payroll for healthcare costs, for health insurance. We look at Medicare, the model for Medicare for All, it's 10%. We could be saving tremendous amounts of money, and we would be relieving our employees of the anxiety of maybe not being able to pay their deductibles and copays.
That same CEO later on said, you know, our insurance policies keep putting pressure on us, asking us how many older workers we have and how we can move them out by giving them the right incentives. Because the older workers cost more in insurance and they don't want to pay that. So the insurance companies push you to get your older workers out. How sick is that system? So now he's obviously a decent person and does not cave into that pressure. The woman sitting next to him also runs a business. She talked about how if my competitors don't pay their health care and just let the American taxpayers pay for it from Medicaid, they'll have a competitive advantage. So now we've set up an incentive to push older people out of their jobs and an incentive to make sure that you are less moral and care less about your own workers. This is madness through and through. And finally, when you're talking about dollars and cents, I mean, look, 2 points he made there. One is about the $13.50 per hour per employee in healthcare costs. You know, the national minimum wage is $7.25, almost half that number. That's crazy. The minimum wage is $7.25. If you hire someone, it costs $13.50 if they have a family per hour to take care of them. And then that is loaded onto the businesses. So it doesn't make any business sense either. That's why Warren Buffett said it's a tapeworm in the belly of our economy, eating away at our competitive advantages vis-a-vis other countries. It doesn't make economic sense. It doesn't make moral sense. And it's literally killing us, the 36,000 people every year that die from not having insurance, and the rest of us that have shorter life expectancies than countries like Canada because we have a worse healthcare system. And finally, to wrap all of that up, an example that one of the doctors gave earlier was, she said it's easier to control blood pressure during checkups than it is to pay for treatment when someone has a stroke. So that's why our system costs about $10,000 per person. Canada is half that, less than half that, at $4,600. And they have a better system that takes care of people better, has better medical results. So we're overpaying because we don't let them have checkups and regular things that they need, and they're worried about their deductibles and they're worried about medical bankruptcies. If we just had Medicare for All, a lot of those problems would not exist, and instead we'd have a humane system that actually makes more economic sense.